brachioradialis. This is very unusual muscle. Okay, we're going to talk about that a little bit. Some of the character in this. So this is this guy. Okay. First of all, this muscle is an exception. Why is it an exception from the rule with all the radial or extensor, all the extensor muscle innervated by radial, they're going to do extension. However, this muscle innervated by the radial nerve, however, they're going to do flexion of the elbow. Okay. First, proximal attachment. Proximal 2/3 of the lateral supracondyle ridge of the humerus, so slightly higher. Start from here. All right. The distal attachment, lateral surface of the radial and lateral surface of the distal end of the radius. Hey, be careful. They are not cross the wrist. So there's nothing to do with your wrist motion. I don't care. Okay, this muscle don't care your wrist. Okay, you just have that insert there on the distal, but not doing anything on your wrist. So don't confuse with that. Main action. Well, flex the forearm, basically what they do. Well, as a matter of fact, this is if your forearm is supinated, actually this muscle could flex your elbow, and meanwhile they also help to, all right? On the other hand, if your arm is pronated, and this muscle may also help you supinate towards neutral. That makes sense. All right? But most important is a flexion. I help you flexion. Innervation, radial nerve. Again, radial nerve is in charge of extensor, except this guy. Okay? So you learn anatomy, you learn the rule, general rule, and remember the exception. You cover everything. Okay? You cover everything. Artery supply, okay, radial recurrent artery. Now this time's radial side because they stop the lateral and come down. All right. So this muscle is very unusual. Remember that. Okay. But this muscle actually is more important to help us to compress the joint, to stabilize our joint, because they have an insert, very sharp angle. So they really help to stabilize our elbow. So this is very important, clinically confused student. Okay, when you have a muscular cutaneous damage, the question, the can patient flex the elbow? Yes, can still, because of this brachioradialis, still able to do. It's weak, it's not that strong. Okay, but remember.